great to be back with the consortium. So I'm going to take the next few minutes to talk about data for air quality advocacy. So I'll highlight the Lung Association's State of the Air report, plus a couple of other reports. And really what I want to do with this time is to share some resources that I hope will be helpful for you in your advocacy work, both here in DC, but then also across the country at every level. You know, of course, you'll hear a lot, have heard a lot, and will hear a lot tomorrow about the value of stories, about patient stories, personal experiences with the impacts of air quality and climate change. We always talk about pairing those with data. So these, I'm hopeful that among the many great resources and research out there with really good data points on air quality and climate change, that the reports I highlight here can be one more tool in your arsenal, particularly because they're all designed to highlight local and state data. And we know that policymakers care most about the places they represent. So of course, the Lung Association, you likely know us well by now. In fact, may have heard a version of this presentation earlier. It's different this time, I promise. But our mission is to save lives by improving lung health and preventing lung disease. And of course, air pollution is a critical part of that. Air pollution and climate change go hand in hand with their health impacts, as you all know well. I've put up this slide here as a reminder of some of those health impacts of air pollution. Again, you're all seeing it, living it, and treating it, but just to frame the conversation. So what I'll dive into first is the American Lung Association's State of the Air report. And I'd love a quick show of hands for those in the room. Sorry, I can't see for those virtually, but of those in the room, how many are familiar with this report? Okay. Hopefully this will add to your knowledge, and for the new folks, I'm excited to introduce it to you. So every year, the American Lung Association puts out our State of the Air report. And the idea here is to put air pollution data into everyday language to make it accessible, particularly for the public and for policymakers. If you leave with nothing else from today's presentation, I will leave you with lung.org/SOTA, that's the website. And I'll say at the top that I'll highlight a few key findings from the 2022 report that I think are relevant to your work here in DC this week. But I'll also note that the new report comes out on April 19th. So on April 19th, when you visit lung.org/SOTA, you will be able to get all the newest data. And I'll walk through where that comes from in a moment to help you use it more effectively. But as those of you who have used the report know well, we look at two pollutants, ozone and particle pollution. We measure in a few different ways that I'll talk about shortly. And what we're doing is we're taking EPA's air quality data that they collect through their system of monitors administered by EPA, by the state, local, and tribal governments. And we're giving letter grades to counties and rankings to metro areas for their levels of ozone and particle pollution. We're not grading the locality's efforts to clean up. What we're saying is, on an A through F scale, what is the quality of the air in Fairfax County that you're breathing? As I mentioned, we rank metro areas. We have a top 25 cleanest list, a most polluted list for each pollutant. And so it's always an interesting point for the media and for policymakers to be able to say, oh, our metro area is the cleanest or the dirtiest or the fourth dirtiest for this particular pollutant. And then another thing that I'll point out on our website shortly is that we look at trends. So on our report website, you'll be able to see over time what have the levels looked like across the years that we've been doing the report, which is 24 years now. So here are a few of the things that we found in last year's report. So the one that came out last April, which is still the current report until the new one comes out. Number one, nearly 9 million more people were impacted by particulate matter air pollution than in the previous report. We saw a big increase in the number of people who lived in places that got failing grades for unhealthy levels of particle pollution. And I'll talk more about that in a moment, but many of you from out west can probably guess why. We also saw more days with very unhealthy and hazardous air quality, the purple and maroon levels of the air quality index, than we have ever seen in the history of the report, a really alarming finding because, again, that was the 23rd annual report. In sum, over 137 million people were living in areas with unhealthy levels of air pollution. And unsurprisingly, the burden of living with polluted air is not equally shared. Last year's report found that people of color are significantly more likely to live in places with failing grades for air pollution. In fact, people of color were 3 times as likely as white people to be living in a place that got a failing grade for all 3 measures in our report. So a few of the top lines that we took from last year's report. Number one, I mentioned that we look at trends. Those trends show that overall, the Clean Air Act is working. The Clean Air Act, the law that governs a lot of the pollution protections that you heard about in the previous section, like the National Ambient Air Quality Standards and many, many others, it's working to clean up a lot of sources of pollution. We have seen that if you look at the counties and their trend charts over time, there is clear improvement in most cases over time as new pollution limits for industrial sources and power plants have kicked in, as vehicles have gotten cleaner. We know that it's working, but there are two caveats to that. Number one, we know that it's not working everywhere. There are still far too many communities, and as we said in the previous point, disproportionately likely to be communities of color that are still waiting for that cleanup. And number two, we are seeing climate change every year in this report's results for the past several years. So we know that increased wildfires, as well as additional weather patterns contributing to particulate matter, are happening more and more. Last year's report very clearly showed the impact of a severe wildfire seasons out west in those particulate matter levels. We also know, of course, that climate change can increase ozone pollution, and there are places in last year's report where we saw those upticks in ozone as well that you would associate with heat. So as you would expect, we have seen over the past couple years, especially in the report, that climate change is showing up in the results. And in many cases, those trend charts that I mentioned, after years of decline in pollution levels, are beginning to tick upward. I'll also note here that, of course, again, we like to use this as a chance to highlight the success of the Clean Air Act. Oftentimes, the headline of our report is X number of people or X% of people are living with unhealthy air. And that's not to say that the air is not clean, much cleaner than it used to be. It is. And it's been a cost-effective cleanup under those Clean Air Act protections. But of course, the climate change penalty that we're seeing and the disparities that we're seeing show that there's still work to do. So I will quickly point out where you can look for this data on April 19th. Of course, you can use it now for the 2022 report, especially for your visits this week, but also where you can use it moving forward. The site will look a little bit different, but essentially the mechanics of it will be the same. At lung.org/SOTA, you'll be able to search by zip code or by state and get your data for your area. If you search by zip code, you'll be able to go directly to your area. If you click on a state, you'll be able to get a full listing of counties. And here are basically what the A through F grades mean. We have 3 different measures of air pollutants in the report. We have ozone, we have short-term particle pollution, and we have year-round particle pollution. So for those short-term spikes, we're looking at the number of unhealthy days over the 3 years of data that we look at in our report. We grade annual particle pollution a little differently. That's an overall average level. We roughly assign the grades to correspond with EPA's air quality index, the levels at which EPA urges different populations to take action to protect their health on days with unhealthy air. However, if you click on your state page and you look at your list of counties, you will notice that a lot of them don't have data. And that's because only about 1/3 of counties nationwide actually have EPA official air quality monitors. Obviously, EPA's funding is limited. That's one of our priorities, is fixing that at the Lung Association, of course. But EPA, in partnership with states and locals, decide where to put the monitors to capture the best proportion of the population. And that means that a lot of places don't have an air quality monitor, and so we can't grade them. I mentioned that we have separate rankings for short-term particles, year-round particles, and ozone. The way that we do the metro areas is we look at the most polluted county in a metro area. We use metropolitan statistical areas and combined statistical areas from the Census Bureau. And then we basically take a look and say, okay, let's look at your most polluted county, because we know that people are moving around within a county. And so that seems like a reasonable way to figure out, what's the overall quality of the air that people are breathing as they move around that metro area. So to dig in a little bit more to the results of that 2022 report, as I mentioned, we are seeing upticks in particle pollution, again, corresponding with what you'd expect, knowing about climate change and wildfires. So we saw more than 63 million Americans live in counties with failing grades for short-term spikes in particles, days at which the short-term 24-hour measure was really high. That's 8.9 million more people than in the previous year's report. We also look at those top 25 lists of most polluted places, and we found that 17 of the 25 most polluted cities for short-term particle pollution got worse. Essentially, they had more days with unhealthy levels than they did in the previous year's report. 8 of those cities hit their highest number on record, so the highest number of days with unhealthy levels of particle pollution ever recorded in our report. I'll also note that when we calculate, we weight the days. So a very unhealthy day counts for more than a unhealthy for sensitive groups day, because we really want to capture the fact that not only are there days with unhealthy levels of particles, but some of those levels have been incredibly high. In fact, here is a graph that we've put together of the very unhealthy purple days for short-term particle pollution and for hazardous maroon days. As you can see, as I mentioned, we have seen more of both of those days than in any previous version of our report, over more than a quarter decade of doing it almost. And you can see the uptick across, especially 2021 and 2022. We also measure year-round particle pollution because, as you all know well, not only is particle pollution dangerous to breathe in at high levels in a short time, it's also dangerous to have lower day in, day out exposure. So we also look at an annual measure of particle pollution. For that in the report, rather than doing a letter grade, it's simply a pass-fail. Does it meet EPA's standard for annual particle pollution, or does it fall short? We also saw big increases for the most polluted places for annual particles. We saw that 18 of the 25 cities most polluted by annual particle pollution had worse levels than in the previous report. 4 cities across California, Oregon, and Washington saw their worst levels ever. We did see some cities improving, including Pittsburgh and Detroit having their lowest levels ever. And before I move on to ozone, I'll note this actually mirrors a trend that we saw overall in last year's report, which is, I mentioned the Clean Air Act is working. We're seeing lots of great cleanup across some of the former big industrially polluted cities in the eastern half of the country. That burden of pollution is shifting westward. So we're actually seeing an increasing disparity coast to coast, half of the country to half of the country, as we clean up a lot of the industrial sources in the east, but we get more wildfires and other types of particulate matter air pollution in the west. I'll also note it's not just wildfires driving particulate matter. Of course, diesel power plants, industrial emissions, also wood stoves is a big source, biomass burning. So there's a variety of sources, but we're really seeing the climate change on the one hand and cleanup of some sources on the other is driving this split in the country into halves, one that's improving and one that's getting worse. We also grade levels of ozone pollution. The Lung Association, we like to say that ozone is like a sunburn on your lungs. The report looks at the health impacts of ozone on a short-term basis. So essentially days with spikes in ozone levels, as well as with particle pollution. 3 out of every 8 Americans live in a county with a failing grade for ozone. That is 122 million people, again, across the 156 counties that are measured in the report. But we saw some improvement for ozone in last year's report. We saw that the most 25 polluted list for ozone. Overall, those cities experienced fewer bad air days across the 2022 report than they did in previous years. In fact, 6 of those cities saw their cleanest year ever for ozone pollution. We also didn't see any record highs for ozone the way we did with particle pollution. One thing I'll mention is that our report uses the 3 most recent years of quality assured data from EPA. And that is not quite caught up. It's a couple years back. We grade it across 3 years because we want a good average to compare to year that doesn't overly take into account a particular year being abnormal. But it also means that last year's report was the first time that we started seeing pandemic-related air quality readings. And so we got the question a lot, what are we seeing, right? Did the shutdowns related to COVID make air quality a lot better? The short answer is we didn't really see that. I think for a few reasons. Number one, we knew that in many cases, a lot of the changes were relatively short-lived across a 3-year average of the report. And number two, of course, people being on the roads less, especially when everybody was really staying home, but certainly telecommuting in general was up. Yeah, absolutely, that can reduce pollution from vehicle traffic for passenger vehicles. But we also know that we started getting a lot of stuff shipped to us. And so a lot of places in the country that are near warehouses or distribution centers didn't necessarily see those air quality gains because there were now heavy-duty vehicles on the road with greater frequency driving e-commerce. So the answer is tough to say exactly what the impact of the pandemic was, especially across a 3-year average. We'll continue to dig into that a little bit more with the coming report on April 19th. But, the way we have talked about it when we've gotten questions about it is to say, to the extent that we did see air pollution reductions, it's certainly a vision of what's possible if we get polluting sources off the road, offline. But also remember that there is likely a big population of people located near warehouses and distribution centers and major shipping corridors that didn't see much benefit. I'll pause here, and I'd like to take a minute to see if there are questions about state of the air before I dive into the next couple of reports.
I would just point out that here in Arlington, the grade is C.
Thank you. It is better than it used to be, but still not where it needs to be. Yes.
Lots of research showing that
it's a great question. The short answer is, and I'll repeat it, yeah. So the question was, a lot of research points to the fact that wildfire pollution is likely more toxic than many other forms of particulate matter pollution. Do we look at that, or do we factor that in? The answer is not currently. We're coming up on our 25th anniversary of the report. Our lead author is looking to revamp the methodology a bit. So she's, looking at ways to make it more finely attuned. We currently don't. We look at all particulate, all fine particulate matter is the same in the report. One other difference to how we treat wildfire is that, I mentioned that we tie the annual particulate matter level to what EPA deems, what EPA's standard is, and that we use EPA's air quality index for the levels of short-term PM and ozone. One thing that EPA does very differently from us when they're determining whether places are meeting those standards is they have a process for exempting what they call exceptional events. So if your community needs to meet the national standard for particulate matter, they can apply to say, hey, EPA, these days with high readings were actually from wildfires. That's not our fault. We can't, they will say, we can't put in place measures to control that. Therefore, it shouldn't count to whether we're meeting the standards or not. Now, at the Lung Association, we can have a separate long conversation about how that process could be improved, but I'll say for the purposes of this report, your lungs don't care if it's an exceptional event deemed by EPA or not. The point of the report is to illustrate for people what the quality of the air they're breathing is. So we don't kick any days out. That's also why the report results will differ from places that are either, in attainment or not of EPA standards, because we don't calculate it the same way because we want to include those days. I think you were first, and then I'll go to you.
So yeah, we have a question online from Larry. They ask, it's kind of in relation to what we've been talking about. How large is the particulate shadow from a typical coal power plant? They mentioned in Michigan, 12 to 6 counties rated for particulates to get an A. How can this be given the large number of deaths, large number of disability caused by particulates? And then, I'm sorry, they also say, is this a byproduct of lax EPA standards?
Both great questions. So I'll answer the second one first. So again, as I mentioned, we base our report's grades on EPA standards. The Lung Association, and I imagine many of you in this room and your organizations all think those standards are too weak. So we have been advocating for a stronger national limit on short-term particle pollution, a stronger national limit on day in, day out annual average particulate pollution, and a stronger ozone standard, because EPA is required to have those standards reflect what the science says is safe to breathe. And right now it doesn't, they don't. You will hear much more about this in a later panel, so I won't steal their thunder, but essentially we are pushing hard based on the health science for those standards to be stronger. And yes, that would absolutely show up in a future report that we had to rewrite to those standards. So currently, while this is as good as we can do under the current standards, there are places that we think have more unhealthy air than the report is showing, than EPA is showing, because the standards are too weak. And to the second question, one challenge is that we're looking at a larger resolution. So I think one thing that the report, in its current methodology isn't really set up to do is to say, okay, what are the differences about, between the experience of someone who's living right next to a coal-fired power plant versus the broader metro area? And so while we're able to look at the overall populations, the racial breakdown of populations to show that overall people of color have much unhealthier air than white people, we're not able to necessarily use the report to point out block-to-block differences in who is exposed to unhealthy levels from some sources. Again, one of the things we're looking at, seeing if we can do with more refinement in the future. Yes.
Especially now with the controversy, probably not controversy here, about whether we should get rid of natural gas. But in New York, it's an environmental justice issue as well, because most of the housing projects have natural gas rate, and the levels of nitrogen dioxide and ozone and benzene and they're very high. And so you might have clean air outside, but you have in your apartment or your home because of the natural gas issue. You have high levels.
Absolutely. The question was, do we look at indoor air quality and the issues around, for example, natural gas appliances in the home? We don't do it in State of the Air, but the Lung Association certainly does. So we actually released a white paper rounding up the research on this topic last year. We're engaging in a combination of education, messaging, and advocacy around how to reduce the health impacts from burning fuel indoors, whether it's a gas stove or a wood stove or a natural gas furnace. So we're digging into this work quite a bit. And I think, one thing that we say is, of course, we're giving policy recommendations. We're also giving personal recommendations, but a lot of those recommendations are, if you are using a gas stove, open a window. That's not necessarily more protective if you're in a very polluted area. So there's a lot of nuance between indoor and outdoor air pollution. But we also know, and I know from experience, and you all probably do too, that while the Lung Association may break down indoor versus outdoor air pollution, I don't think that's how the public sees it, right? They want to know that they have clean air, whether they're in their homes or outside. And so it's an area that we're doing more and more on to engage folks, and I'm happy to pass along resources. Go ahead.
Hi, thank you so much for the report. I had a question about in counties where there isn't data because there's not enough monitoring. Has there been any efforts to work with, like there's apps that are utilizing devices that people are putting in their own homes and collecting data that way, where there's some way to kind of circumvent if the government doesn't want to do it in the local area? And so I just was curious if there's anything happening in that.
Yeah, so we're looking at it, how we might incorporate it into the report. There's a few resources. So number one, as you mentioned, Purple Air does track particle pollution data from people that have the monitors. One cool way we've seen that integrated is that EPA, again, those of you in the West probably know this well, EPA has a wildfire smoke map using Purple Air data. What I've heard from folks who have used it is that it's helpful because the standard EPA air monitoring forecasts at airnow.gov aren't necessarily as hour to hour as they need to be if you're living in a place with wildfire smoke. If you want to know, is it going to clear up in the next hour, so I should walk my dog later versus now? EPA has incorporated some Purple Air data to be able to help answer those questions. The other cool place where there is more data is from satellites. So NASA actually operates several air quality monitoring satellites. And I can certainly share along the resources for that after this. There's a lot out there. And so we're actually working with NASA to do a pilot project to see how we might be able to integrate some of that into the report down the line in the future. Yes.
One of the things is funding for early investigators. Many of your grants have been with scientists and using traditional people. I don't know if there is anything that's going to be specifically for climate or specifically for health disparities and climate that could get to the young investigator early rather than trying to compete in the established categories that the Lung Association offers.
I appreciate that. And we'll pass it along to our research team. Oh, I'm so sorry. The comment was in the Lung Association, and I'm sure a whole plethora of other institutions too offer research funding, but we're not necessarily getting at the early in their career investigators who could do early work now on clean air and climate and disparities issues as opposed to competing for a smaller pool of researchers later. Any questions on State of the Air? I'm about to shift topics. Okay, well, thanks for the great conversation. And as I said, I'm happy to make more resources available after this, and I will put my email up at the end, but I'm always happy to talk. Okay, so two more quick things I want to highlight with my time. I think one of the things that the consortium has been a fabulous leader in, both professionally and also for me personally in my own work, has been shifting away from talking just about the problems to talking about what's possible with the solutions. And so one of the ways that we incorporated that last year was we issued a new report called Zeroing In on Healthy Air. If I leave you with not one, but two things today, that URL is at lung.org/EV. So last March, we engaged with a modeling firm to look at the impact if we got to a truly zero emission future as a country. So for that, we meant 100% of new passenger vehicles being sold were zero emission by 2035. 100% of medium and heavy duty vehicles being sold were zero emission by 2040. And if our power grid got to 100% non-combustion electricity generation by 2035. On that last point, I know that that matches President Biden's goal, although we took it a step further. He said 100% clean. We said at the Lung Association, if it's going to be clean, we can't be burning anything. So we're going to make sure that that does not include biomass or any other forms of electricity generation that do emit. So what we found was really impressive. So we looked cumulatively at the public health benefits, so the value of the public health benefits of that transition from 2020 to 2050 at the national level. We found that that transition would lead to $1.2 trillion. So I'll say again, a nationwide transition to zero emission light, medium, and heavy duty vehicles, so cars, trucks, buses, vans, powered by 100% clean non-combustion electricity would lead to $1.2 trillion in public health benefits across that timescale. Those benefits include 110,000 premature deaths avoided, 2.7 million asthma attacks avoided, and 13.4 million lost days of work avoided.
The model, the EPA COBRA model.
That was one of the ingredients in the mix, yes. That is separate from the climate benefits. So that previous slide was just the monetized value of all of those health impacts. If you look at the additional climate benefits, looking at the social cost of carbon, so what dollar value do we assign to avoiding climate change, we see $1.7 trillion additional in global climate benefits. And I think as we all probably can imagine, that is likely an underestimate based on the numbers that we have. I want to point out here too that the report, we put a spotlight on vehicles in the report, but we really were conscious about saying it's not just that we get cleaner cars and trucks. We really need to get to cleaner cars and trucks combined with clean electricity. Because obviously, if we are charging our cleaner cars and trucks with dirty power, we're not necessarily going to see the benefits. So we saw enormous emissions reductions in the modeling by vehicle type. So 92% reduction in nitrogen oxides, major reductions in fine particulate matter, and in greenhouse gases. One other interesting thing to point out here is that the overall share of pollutants is different across cars and trucks. So cars are really driving greenhouse gas pollution. So 63% of the overall vehicle greenhouse gases is coming from light duty vehicles, so cars, SUVs. 89% of the nitrogen oxide emissions from vehicles is coming from heavy duty trucks, heavy duty vehicles that also includes buses and some other equipment. So we really see huge benefits in CO2 by cleaning up our cars, huge benefits in reducing nitrogen dioxides, which can react to form ozone particles and are dangerous on their own by cleaning up trucks. Before I move on to this, the subset of this report, one other benefit of the Zeroing In on Healthy Air report is that we include state level data. So at lung.org/EV, you can see a state-by-state breakdown of what are each state's numbers. So their share of that $1.3 trillion in public health benefit, deaths avoided, asthma attacks avoided, et cetera. We also ran the numbers for some metro areas as well. Rather than try and dig into that here, I will just send you to the report website. There's lots of resources there, including fact sheets that you can actually use in your own advocacy if you choose to. And then the last thing I'll highlight here is a spotlight that we shown on heavy duty vehicles with a report that was an offshoot of that first report, Delivering Clean Air, the health benefits of zero emission trucks and electricity. This came out last fall. So we thought it was especially important to shine a spotlight on trucks. Heavy duty vehicles are a small proportion of the vehicles on our roads, but an enormous driver of emissions. So I mentioned NOx, trucks are the largest share of nitrogen oxide on the road. They're also really the big driver, no pun intended, of particulate matter pollution, despite being a small piece of the pie of the overall number of vehicles on the road. We know that heavy duty pollution, traffic pollution specifically, is a driver of major health harms. I highlight here this a panel from the Health Effects Institute that found relatively recently strong connections between traffic-related air pollutions and early death due to cardiovascular causes, lung cancer mortality, even asthma onset and acute lower respiratory infections in children. We all know that heavy duty vehicles are bad for us, but this was just one of many, many research reviews that really points out the disproportionate toll that heavy duty pollution is taking on our health. And then the genesis for this report really came actually from EPA, because they put out a transportation and environmental justice fact sheet. And they included the stat that 72 million Americans live near truck freight routes. It's not just that vehicles are polluting, of course, it's also that people living near routes with heavy truck traffic specifically, not just major roads, but a lot of trucks, are experiencing disproportionate health impacts. And as you would likely expect, more likely to be communities of color, more likely to be communities of lower income. So we took some of the data from our Zeroing In on Healthy Air report and made a truck specific report. So what we did was we looked again at what would the benefits be if we got all heavy duty vehicles as well as medium duty vehicles to zero emission. So 100% new of those vehicles being sold would be zero emission vehicles by 2040. So that looks at, big tractor trailers, buses, but also your, last mile delivery vans, some of those more medium-sized vehicles between a car and a truck. And what we did with this analysis was we specifically looked at places with major truck traffic. So we found the counties with the most truck traffic living on the most major truck routes, and specifically honed in on the benefits to those communities. And again, it's an impressive number, $735 billion in public health benefits, 66,000 plus premature deaths avoided, 1.7 million asthma attacks avoided, and 8.5 million lost work days avoided. And again, that's from a transition to clean, medium, and heavy duty vehicles and clean, renewable, non-combustion electricity in places with major truck routes. So I'll leave a few minutes for questions at the end. But again, I'll direct folks to lung.org/EV. That's actually where both reports live. So Zeroing In on Healthy Air, the overall trucks plus cars report has lots of information, including state-by-state breakdowns, a map of the metro areas that stand to benefit the most, fact sheets that you can actually download and use. And then the trucks report is available there as well and really digs into, okay, what are these communities with the heaviest trucking pollution? And what can we gain from an equity and environmental justice perspective by cleaning up those sources of heavy duty vehicle pollution? And I'll also give you a quick preview that we are actually going to break out the car specific data into a future report later this year. And would love to share that with you when it's ready as well. So what I hope will be useful from all this is, number one, again, we all know the value of a personal story. We'll talk a lot more about that over the next couple of days. It's helpful to have a couple localized data points to pair with it. And so the way I use State of the Air, as well as these reports, is if I'm meeting with a lawmaker or their staff, if we're highlighting to a local media outlet, it's a great way to be able to say, hey, this community got a failing grade for its levels of particle pollution, and our report shows that X number of people could benefit if we were to get to a zero emission future. We hope it's helpful, and we want your feedback. So if there are ways we can make the report more helpful, I always want to hear them. Each report also has policy recommendations. So State of the Air has recommendations for individual action. Of course, a lot of people, when we're communicating with the general public, want to know, okay, what do I do about this in my own life? So we certainly have that. But we also have a few policy priorities at the state, federal, as well as local levels. We also highlight tribes as well for what they can do with this data. And with that, I'd love to take your questions.
Okay, so we just. Okay, so somebody asks, is a school bus considered a heavy duty vehicle?
Yes, a school bus is considered a heavy duty vehicle, as is a transit bus.
And then we have another question from Larry. Are the 1.2 trillion, 1.7 trillion total, or are they annual benefits?
They're total across the timescale of the report. So those benefits are 2020 through 2050 stacked year on year. And I do want to point out the global climate benefits number is separate from the public health benefit dollar figure.
Thank you so much for your report. I just had a question on practically using the State of the Air report. So in Illinois, Elwood, Illinois is the largest inland port in the, I don't know if that's international or national, but the people of Elwood definitely know that asthma rates have increased, but that's in Cook County, so you can't get really granular information. So I think the State of the Air report is very good for some meetings, but then when you try to delve in and find out, you know, exactly how much damage is happening in this area, there's a paucity of information. So maybe you could just give some suggestions on, because I'm constantly trying to convince people to take action and telling them that local air matters. So, and then my second question is, what do you think about like the commercial air quality monitors? Like I think it's IQ Air that organizations can purchase and put where they need them.
Yeah, thanks for the question. So on the first point, yeah, I absolutely agree. I mean, looking at the county level has a lot of benefits for the report. It's a strong methodology. There's a reason we stick to it, but it's, you know, it won't necessarily capture differences in air pollution exposure within a county. One thing I should have pointed out earlier is that, and I want to make before I forget, is that even if your county doesn't have monitoring data, however, the report still includes estimates of populations at risk. So we know that kids with asthma, people with COPD, people with heart disease are all at greater risk of health harm from air pollution. We do include estimated population totals for every county. So even if you're meeting with someone and you don't have an air quality ranking or grade, you can say, we know that there are 30,000 people with asthma in the county who are more susceptible. But yeah, I think, you know, what I have found most effective when meeting with folks at a more local level is to really use that as an opportunity to pair in examples. So, you know, of course, for the Lung Association, you know, we get a lot of calls from people who are experiencing air quality issues. So that's often where I point to say, you know, here are some examples without sharing too much personally of people who have a neighbor with a wood stove and what the health impacts they experience are, or, you know, live near this type of facility. Here's what they're saying. And if, you know, if possible, bring that person in, right? I mean, I know, you know, for us, if it's a meeting with a lawmaker and we can bring the storyteller in person, all the better. But it's definitely something that I would love to figure out how to do, you know, down the road. How can we do a more granular job of representing some of the air quality challenges within counties? Oh, I didn't answer your second question. Sorry. So the second question, we love more data. So I think we would say that on personal air quality sensors, we have actually signed on our support for a piece of legislation that would work with EPA to build in more data, you know, look down the road about how they could better incorporate some of that sensor data. I think right now we would say, you know, it's certainly not a substitute for the official monitor if you're determining whether a community is meeting the law, meeting the legal requirements, because there's a lot that EPA does with those monitors. They have specific siting criteria. They have to be maintained a certain way to make sure that they're solid. But yeah, I mean, at the Lung Association, we certainly, you know, we see a lot of value in that data and a lot of possibility in it.
Yeah, I think, you know, when I've just done some reading on that, my biggest question with those individual air quality monitors are they air quality monitors?
Right. And are they being, you know, used in a way that would be the same siting criteria to get the cleanest data? You know, I think on average, we would, you know, on average, looking at a broad scale, like with EPA's work incorporating the purple air sensors, yeah, they can definitely provide additional information, even if they're not yet ready to be a substitute for, you know, the official regulatory monitors.
Thank you.
Thank you. I think I have time for 2 more questions.
Well, I guess I am Paul Friedrichs from New Hampshire. I guess my question is related to what you just answered about the air quality index monitors. I guess my question is, I've had particularly young people reference air quality by, you know, what's on the weather app in their report. And are those sorts of things that we get from meteorologists, either on TV or on the weather app, is that accurate?
So they come from a couple different places. So a lot of meteorologists will report the EPA forecast, which we certainly send people to. airnow.gov is where you can get those directly from EPA. The other, I know that the air quality forecast that you get if you have an iPhone is not actually the same as EPA's. It's a company that does their own proprietary mix of factors. I haven't delved into their methodology too much. It seems reasonable on its face, but I haven't compared too closely. But I know that there are other ways out there beyond EPA of getting that data across.
Okay, and so there's a question from Kathleen. Do improved building codes have the potential to make a significant difference in indoor air quality?
Yes, absolutely. Yeah. So the Lung Association on our list of indoor air quality advocacy topics, definitely building codes. There's definitely more we can do around appliance efficiency. There's a lot of, with outdoor air pollution, we have the Clean Air Act. The Clean Air Act allows EPA to, specifically limit emissions from different types of polluting sources, from vehicles. We have the National Ambient Air Quality Standards. They put a limit on the overall amount of pollution that can be in the air. There's not the same framework for indoor air quality. So there's not the same central federal government focus that we can apply to it, but that also means that there's a lot of opportunity, particularly at the local level. Well, thank you so much. I really always appreciate the chance to talk to you all. I love the conversation and I want to continue to be in touch. Thank you. So please do reach out. Always happy to talk about state of the air and our other reports. Thanks.
We'll just take a quick 5-minute stretch break and then we'll get started at 4:10.